Hi, my name is Jennifer Brand, and this is my presentation on the NBD Obsessive Compulsive Disorder. The definition of OCD is an anxiety disorder that brings about repetitive and unwelcome thoughts, ideas, feelings, and obsessions for the person. The person often feels the need to act on these behaviors, resulting in a compulsion. Usually, the obsessions and compulsions do not make sense, and the person with OCD often knows that the behavior is irrational, but they can't do anything to stop it. Some of the symptoms of OCD are, of course, obsessions, which are germs and a fear of an illness, safety and a need for symmetry and exactness. And common compulsions are constantly washing one's hands, checking and arranging, counting, repetitive routine behaviors, such as repetitively locking and unlocking a door, and hoarding, which is keeping a lot of unnecessary things. Usually the person carries out the behavior to try to get rid of the obsessive thoughts, but this only gives them temporary relief. And if they don't perform the obsessive ritual at all, it can cause extreme anxiety. There is no exact proven cause of OCD, but research has shown that the following things could result in OCD. Brain abnormalities. Some experts believe that OCD is related to levels of a normal chemical in the brain called serotonin. When the level of serotonin is abnormal, the brain can misinterpret information. Another possible cause is infection. In some cases, OCD has been linked with a strep infection. If a person has a genetic tendency for OCD and has developed a strep infection, OCD can sometimes develop. And also genetics. Those with OCD are most likely to have someone in their family with a disorder as well. There are two main ways that OCD is treated: medication and therapy. There are different types of drugs that can help treat OCD, and there's also types of therapy that can help with the disorder. Cognitive behavioral therapy helps the person to learn to use the power of their own behavior to change their thoughts and behaviors for the better. And the specific type of cognitive behavioral therapy is called response and ritual prevention. When teaching students with OCD, it's important to exhibit the following characteristics so that the student is in the best possible environment for learning. A calm classroom environment definitely helps. Flexibility with due dates on homework and in-class activities, because sometimes these obsessions can relate to completing homework, so it can take longer for them to complete in-class and homework assignments. Allowed breaks when needed. This helps when their disorder is acting up. They can take a break and go, have some time to kind of regroup. And then kindness and patience are key characteristics when working with students with OCD. And finally, these are the references that I use for this presentation. Thanks, everyone.